Hello, this is Dr. Evan Mahoney. Today is an advanced acupuncture technique. It's using kinetic acupuncture and it's for the treatment of plantar fasciitis. Kinetic acupuncture, I learned this technique from Dr. Hyung-Suk Choi, the chief practitioner of Hamso Children's Hospital in Los Angeles. This is for the treatment of plantar fasciitis with kinetic acupuncture. First, as most any procedure on plantar fasciitis will involve some form of stretching exercise of the gastrocnemics and the soleus. There's hundreds of stretching videos online. Now we are going to incorporate one of those stretching techniques with acupuncture, and that's what defines kinetic acupuncture. Kinetic acupuncture is movement of joint or limb while the needles are inserted. Now today's demonstration, I'm not going to be actually inserting needles. This is just a simulated demonstration of the technique. Plantar fasciitis is defined as pain on the bottom of the foot or pain along the heel or Achilles tendonitis. So as part of the kinetic acupuncture technique, which may be technique number one that you use, you're not going to be needling down here. Later you can go and do a local needle. But for the kinetic acupuncture, the work is going to be done here on the calf muscle. Now, before we begin, we have to explain why. Why do you get plantar fasciitis, pain at the bottom of the foot or pain at the heel? The answer is in trigger points. Trigger points. Trigger points are the clusters or the knots within a muscle tissue. If you ever get a massage and you have a knot, they say you have a knot, that is a trigger point in the muscle. And as a demonstration, if you have a piece of rope and you tie a knot in the rope, it shortens the length of the rope. So if you get a knot in the muscle, it shortens the length of the muscle. This muscle becomes short, the tension on the Achilles tendon becomes more stretched, there's more friction involved, the tendons underneath the foot also are pulled. There can be inflammation or calcification where these tendons stress against another tissue. So the treatment for kinetic acupuncture strictly involves on the calf muscle. Now, when the patient comes to your office, how do you examine them and how do you make the diagnosis that the problem is here? It's a very simple demonstration. We're going to ask the patient to put their muscle in a stretch. And the knots, to find the knots and the trigger points, we're going to rub our finger upward against the movement, against the muscle, while the muscle's in a stretch. So at this point, I would take some sombra cream or gel, whatever kind of oil, and I ask the patient to stretch their muscle, okay? So this is a calf muscle stretch. Now you take the oil and you rub it up the muscle. How do you know if this is the problem? This will be painful to the patient. By just pressing your finger, the patient will have pain. Number two, you will feel the knots in the muscle. You'll feel the knots on the medial side of the calf muscle. The knots can occur anywhere from the lower to the upper gastrocnemics, but it's typically on the inside muscle. So at this point, by running the finger, the patient has pain and you feel the knots. You can be certain that the problem is here. The muscle became shorter because the knots is a tangle and cluster of muscle tissue that shortens. The Achilles tendon stretched and all the underlying tendons. So we want to release these trigger points. We want to relax the muscle and stretch the muscle. If the muscle is more stretched, then there's less tension on the tendons and the underlying tendons and tissue. The patient should experience alleviation of pain after the treatment. Okay, so at this point, after we've diagnosed the knots, you found the knots, we begin to do the acupuncture. And wherever there's a knot, now remember, keep the patient in the stretch position, okay? So the patient remains in the stretch position with the needle insertion. We find the trigger points and we insert the needle. You can do a little probing to the side, in and down, but you do not want, okay, so that's a little probing into the trigger point. Now, as you continue to do them, the patient may experience pain, and part of this procedure may be painful. So what you want to do is you want to just have a shallow or superficial insertion of the needle in the skin. I repeat, you want to remain the needles with a shallow superficial insertion, maybe 0.3 chun as part of the needle. Okay, so I've done my acupuncture. I probed a little bit into these trigger points, and anywhere from, a few needles to 8, less than 8 needles, anywhere with these nuts. The needles remain in place, and while the needles are in place, you're going to ask the patient to do an exercise. So first, to test, you ask them to stand up and down on their foot. So just stand up and down on the heel. You'll see they lift the heel up while the needles are still in place. Up and down, up and down, up and down. So you'll see when you get the needle, you'll see the needles move. As she lifts up, the needles will go up and down. That's helping to break up the trigger points in the tissue. It creates a circulation of blood and oxygen to the muscle. That's what the trigger point does. It restricts the circulation of blood and oxygen to the muscle, shortens the muscle. The muscle becomes a beef jerky-like consistency. Becomes very dry and stringy. That's what the presence of trigger points does. So these needles help to break up these trigger points. Now, as she's lifting up and down, you're going to add a resistance, and this becomes an isometric exercise. So as she lifts up, you're going to resist that motion with your hand down here. This is an isometric stretching exercise. So put the muscle in a stretch, and then add the flexion, but with resistance. That's going to help stretch the muscle. Okay. Now, while the needles are still in place, you can have the patient twist her foot. You can have her stretch whichever way so that she can stretch where the areas of the needles are inserted. So with your foot on the ground, just turn your leg to the side. You can twist and bend. You want to stretch the area of the needle. And then finally, lastly, as a last stretch, you can bring the foot forward, and with your heel this way, lift up your toes. Lift up your toes. So right now she's doing this. She can also bend forward and get a stretch. She can bend forward and get a stretch on these. While she's in this position, you can stretch on this part of the leg. Okay. All right. So this is just a simulated demonstration of the acupuncture technique. As a word of caution, it can be a little bit painful, but the patients will notice a result right away. This is part 1. Then you can begin part 2 of whatever therapy you use. You can do some local points down here after that. So this has been a demonstration of kinetic acupuncture, and any questions, you can look it up.